Greetings, everyone. My name is Steve McPhail. I'm the director and founder of OET Online, here to provide you with a session focused on reading strategies to ensure you can perform to the top of your ability in this part of the exam. So, with reading, we're going to focus on reading, and you need to have a strategic approach. You need to understand what you're reading. You need to be reading regularly and have good skills. But you also need to, in order to get the maximum score you can get and minimize errors and make the right choices, having a strategic approach is really important. That's what we'll be looking at. But if you want to know a little bit about who we are, if you've got your phone out, you can just scan that QR code and that will take you to our website, and you can contact us at info@oetonline.net.au for course inquiries. Great options, everyone, to help you prepare for this exam. And of course, we are a premium preparation partner, and we've been doing this for over 15 years. Okay, let's get started. Now, reading part A. I hope this isn't you, this person here with the magnifying glass and the pile of hay. What are they looking for? You know the idiom. They're searching for a needle in a haystack. Now, this guy doesn't seem to have a plan, seems pretty stressed and lost. That's not where you want to be on exam day. We need a strategy. You're also going to have the clock ticking, whether it's an online exam looking at your computer, or if you're doing an in-venue test up on the wall, you'll see that timer, and there'll even be announcements telling you how much time you've got left. All things which can cause stress, but you need to remove yourself from that and focus on the job at hand. What is a job at hand? Well, answering 20 questions in 15 minutes. Now, the good news is, like any exam, you need to understand how tests are designed, because this is going to help you perform well on exam day. So let's look at the construct. And this is really the beauty of OET. This is why everyone loves OET. It's why I love OET compared to other English language tests, because it really is replicating the medical workplace, right? That's what it does. So if you think about part A, they know in the workplace, when you're treating your patients, you can't keep everything up here. There are a lot of rules, protocols that you must follow. So part A is designed to test your ability to look through and locate specific information in order to treat a patient as you would in the workplace, right? That's the design. And the flow of information is going to be really logical. Let's have a look at this. So if you have 4 texts on malaria, perhaps text A talks about the background, the classification. It's a bit of an overview of what malaria is, maybe the types of malaria there. Text B might be about the symptoms that patients face. Text C is the assessment, the laboratory, to find out what strain perhaps of malaria it is. And there might be different types of ways to do that. And then text C might be about treatment. That often would involve medication, right? But there may be other conservative measures, right? That's a typical structure, right? Perhaps the lab test is in a table. So each different type of test is evaluated, right? So that could be a table. Symptoms quite often has bullet points. There might be a bit of a paragraph and a list of bullet points so you can skim and scan quickly. If we look at tetanus, perhaps text A is about risk factors or symptoms. Might get straight into that, who's susceptible. Text B, well, we know tetanus is one of those conditions that you can vaccinate against, so there's a whole lot of information about different types of immunization. Again, perfect place for a table, evaluating the different dosages and when the immunizations occur, the time frame, that sort of information. Text C might be about treatment for someone who does have tetanus. What are the different modalities of treatment, including medication? Text D could be purely on contraindications or side effects associated with that treatment. So there'll always be a focus in each text. And that's really important because the more quickly you understand the focus of each text, the easier it is for you to be able to quickly locate where the information is. All right, so let's do an example of that, everyone. I'll bring up my share. So now I'm looking at a standard part A text we have on the left and questions on the right. So if we look at this, we've got 4 texts A, B, C, and D. And I've got some mini questions here, everyone. So as I would allow about 3 minutes to scan this section, right? 3 minutes for just looking at the text. And as we look through, we look at our bold, fractures, dislocation, sprain. We can see some information there that is quite useful. I like to read a little bit here. Often I heard direct, indirect injury, twisting, violence to bones. And then fractures are either closed, compound. Be underlining some of these words. There's a dislocation. And following that is a definition. I won't read that. Sprain, I won't read that. But I probably would have read a bit about fractures. Then text B, simple fractures of limbs. Now, I'm going to look at my headings here, everyone. This is a lot of information to read. You should not read all of this. So if you're doing something like this, what I would suggest you do, look at the headings, immediate management, hold any hemorrhage, and I'd just be looking at keywords, half the sentence, immobilize. This only provide pain relief. I'm going to read in chunks, provide pain relief, all at once. Clinical assessment, obtain complete medical history, perform standard clinical observations, perform physical. Now, I'm only reading the beginning. Examine. Now, I won't read all these words. Check. Down here, management. Splint the site of the fracture. Elevate the limb. Administer analgesia. Consider X-ray. So that's really enough for me. I've got a general idea. This is all about assessment and management, isn't it, everyone? So we know the focus. And I always pay attention to structure because these are instructions, right? I can see lots of verbs. As I scroll further, we come to our table. Now, I love tables, everyone, and so should you, because I don't need to go around in circles looking for that needle in a haystack. With a table, I'm definitely going to apply a structure. And what I can do with the table, I can look at the top, drug, form, strength, route, recommended dosage. I probably won't read this top section. I'll have to read it later to search for answers. And I probably won't read this bottom section. I'm really interested in the tables. We've got morphine, the ampule, dosage. I'm not going to go through everything. I can capture this information when I need it. But I know it's about the medications, about morphine, and the details about how you administer it. Fantastic. And then I come down to text D. Technique for plaster backstab. Always read the headings. For arm fractures, oh, it's a technique. Use same principle. So again, I'm going to do a little bit like text B. I am going to look at my verbs. measure a length, okay? Wrap cotton padding, measure a length of plastic, immerse in a bowl of water, ensure jewelry removed, mold the slab, do not apply pressure, wrap crepe bandage. That's enough. This is a technique. These are instructions for a back slab. All right, as health professionals, you'll be familiar with this, even if you're not a nurse or doctor, it's sort of common technique so you can understand the type of structure. So now I would allow about 3 minutes, time well spent. Now we look at our questions. Now we have 3 types of questions in part A. Matching, there'll be 7 questions. Short answers, maybe 6. And then maybe another 7 for gap fills, right? So, how fractures can be caused? Which reading, where did they talk about the cause? Well, we know it's not B, because that was management. And we know it's not C, because that's drugs. And D was about back slab. So it must be A. Now I can double check how they can be caused. And it says, occur often, direct, following direct or indirect injury, twisting, violence to bone. That's it. That's the cause. So I know my answer's A. Didn't have to read the whole paragraph to get that. The procedure to follow when splinting a fractured limb. Okay, splinting. Now, I know it's not A. I also know it's not C. Is it D? D is talking about back slab. Or is there something about splinting in B? So we skim through immediate management, clinical assessment, more management, and I find that word splint, the procedure. Okay, is this a procedure? Splint the site of the fracture, elevate the limb, administer analgesia, consider a certain syndrome, X-ray. That's a procedure, everyone. So, you know, part B is not that hard. We're finding these answers fairly quickly. And you need to do that, right? You've got to get in the zone with this stuff so you can do this quickly, as I'm showing in this example. Once you're comfortable and confident with this exam, you've done enough practice, you're familiar with the type of text, you can identify the patterns, you can answer questions quickly. So we go to number 3. What are the common side effects associated with morphine? Well, we all know morphine is going to be in text C because that's our medication text. We can go there quickly. Now I've got to find side effects. But if I look along these top headings, nothing mentioned about side effects. So I'm going to go to the bottom, lower end, over 70, provide consumer advice, can cause, there it is, everyone. What are the common side effects? And nausea, vomiting, drowsiness. So I do a copy and paste technique, everyone. I must type that in, nausea. And I'm going to go word for word. And vomiting, comma, drowsiness. So very much a copy and paste activity there. All right. Common side effects. There's my answer. I located it. I knew it was going to be in C. I just had to find out where. Next one. What position should the hand be in when applying the back slab? Well, we know back slab is text D, so we can go there quite quickly, right? Which we will. We scroll. Now I need a search word. It can't be back slab because that's my topic. So the other noun is position and hand. I'm looking for these words. So I am really going to have to scroll down and look. And I might have underlined it before. I can see all these actions, but these aren't nouns. I keep looking, but eventually, and you might be seeing it on your screen, I find that word position. And then I find hand. Bingo. What position should the hand be in when applying the back slab? I will read it. Lightly mold the slab to the contours of the arm and hand in a neutral position. There's my answer, everyone. So I'll type in neutral. right? I am doing okay because I've done my pre-reading. Now, these are short answer questions. What about gap fills? We have to complete the sentence. If the nature of injury cannot be established, manage as a... Well, that doesn't sound like back slab. Establishing, it's certainly not medication. And management, well, I've got two things on management here. So I think it must be text B. So I look at the top, management, nature of injury. In my mind, I'm going to say it, the nature of injury cannot be established. How? How did they get the injury? That's what I'm looking for. And it's not mentioned up the top. Splint, elevator sling. And then I find the word. If in doubt, there it is. If in doubt over an injury, treat as a fracture. I double check. If it cannot be established, that means there's a doubt. So treat as a fracture, treat, manage are synonyms. So I found my answer. Take a little bit longer, that one, but I have enough common words. Manage as a, treat as a. Copy and paste, everyone. As part of routine clinical examinations, it's important to something, it's going to be a verb. Signs and symptoms. Okay, this is my search word. Routine clinical examinations. I remember seeing clinical examinations. Memories can help you. And look, I've got clinical observations. Standard is root. Oh, this is it. Perform. Standard. As part of routine, it's important to perform signs. I can't perform signs, and I need to read this. Examine and record color, warmth, movement, sensation, hands and feet. Well, that's signs and symptoms, isn't it? Color, warmth, examine. As part of an examination, it's important to... Now, this is a bit of a trap. I could put examine and record, but I've already got clinical. So I'm only going to use one word. It's important to record signs and symptoms because I've already done my examination. And routine, everyone, means standard. So the vocabulary helps. So I'm going to put it's important to record signs and symptoms. Okay, last one. Apply pressure to the wound site to stop something. Who remembers reading that? Apply pressure to stop. So you might think logically that you'll start going down, right? But just remember, I think we're in text B, you can always go backwards as well. You can go across, you can go that way. That's skimming and scanning. Your eye should move. Now, in this case, we want to stop something, and I've got this immediate management. Probably as medical professionals, you know what you want to stop, right? If it's a wound, maybe you want to stop the blood, right? You can use your medical knowledge. Then we can look at the first bullet point. Halt any external hemorrhage by a pressure bandage or direct apply pressure. What are we stopping? Halt. Halt means stop any external hemorrhage, to stop. So that's our answer. May not need any, but I'll put it in anyway. External. Now I'm going to make sure that I spelled hemorrhage correctly. And then I've got my answer, everyone. Double check it. Hemorrhage, because I don't want to lose because the spelling must be accurate. And there's my answer. Now that's your technique, everyone, for part A. That's a simple example, but you just expand on that. And the more you do it, the better you'll get. And there's great websites out there where you can find, just search for instructions on how to, on medical conditions, right? Particularly websites like Medscape and that, where you'll often find, or the Mayo Clinic, things. There's great websites where they give similar texts and tables to what you see here. Make sure you're studying these types of documents to build your speed, set your timer, manage your time. You might start off slow. You may not be able to achieve the score you want initially, but as your skill builds, you will get faster. Your scores will get better. Practice is the key. All right, that's part A, everyone. Now, let's have a look at some part B content. But before we do that, actually not part B. So just a recap there of our part A. So that's our 3 minutes to skim the texts. Then for the matching questions, you should be able to do it in about 2 minutes because you had a strong foundation. That gives you 5 minutes each for the sentence completion and the short answer, total 15 minutes. Work hard on those skills, set the good foundation with your skimming, and you'll get to love part A, right? It is the easiest part of the exam, except for the time pressure. All right. Now, let's talk about multiple choice questions. While part B and part A are different and there's different degrees of complexity, they both contain multiple choice questions. All right, so strategies are similar. Now, for you as health professionals, it's all about critical thinking. This is an exam, right? You're being tested, right? So you've got to demonstrate skills. So there's 3 elements of critical thinking. Engagement, right? Engagement here means engage with the question stem, know what's being asked, engage with the text, read to understand, and engage with the answer choices. And really, when I mean engage with the answer choices, I mean analyze the answer choices, right? Look at the words, look at the language, apply logical reasoning as a health professional. Does it match your knowledge? Does it sound right to you? Or are you suspicious? Is it maybe, oh, that doesn't sound logical? You've got to be doing all of these things as you read, and that is a skill to develop. The other thing that I recommend is that you apply the QTA method. Read the question stem, then read the text, then look at your answer choices and rule in and rule out, right? This is particularly good for part C. For part B, if the answers are short, you may decide to look at the answer choices as well. That's perfectly acceptable. The bottom line is, though, you've got to find what works for you. But I do strongly advise, particularly for part C, that you read the paragraph, because the best strategy is to understand, and then the associated strategies help you make the right choice, especially when 2 answers are close. So just a quick thing on critical reading skills. We've got to be cautious here, right? So there are certain answer choices where caution is required. For example, and when I say caution, I mean just be aware. You have to notice it. So some answers will change the subject. When you're doing the ruling out, patients are concerned about side effects versus doctors are concerned about side effects. That's an oldie, patients, doctors. You will see this type, because remember, the item writers are creating errors, so to speak, in the answer choices, and you need to identify them. Watch out for comparisons. Something is more than or less than something else. Side effects of medication X are worse than medication Y. These types of questions are often a bit too simple for this type of reading test. They're really looking for you to understand more complex or abstract thoughts, and this is quite concrete. So if I see comparisons, I'm cautious. It doesn't mean it's wrong, but I'm alert. I'm alert to this. Maybe it's a trap. Describe an increase or decrease. There has been an increase in side effects from medication X. These answers are very tempting because they're easy to understand. You're like, oh, yes, that's right. But does it match what's in the text? Very cautious with these type, with answer choices worded this way. Watch out for 100% certainty, will, must, always, all, and so on. Medication X always causes side effects. It's a bit too strong. It's more likely if it's a possibility. So it just doesn't mean the answer is wrong, but we need to be cautious. Watch out for answer choices that have an extra detail that's not mentioned in the paragraph. Medication X is very effective. That might be mentioned. That part of the answer choice might be correct. But then at relieving lower back pain, that might be the not given element. It's very common again. Half of the answer choice is right, but the other half is wrong. So they're testing your ability to read carefully. And sometimes informal expression. Medication X has too many side effects. It just doesn't sound professional. Can also be a way to determine that an answer is unlikely. So we're going to be cautious. Now, answer choices to consider, and these are just a few examples, and there are many. Answers which express an appropriate degree of certainty. Medication X may cause side effects. Watch out for your mays and rights. You see mays and mights? You should consider that. It may be the correct answer. It may not, but it has a stronger possibility probably than always or will. Recent studies indicate an increased likelihood of side effects. That's formal style of writing, likelihood, a chance. Okay, now main ideas can be found in the independent clause within a complex sentence. So a complex sentence has a dependent and an independent clause. So main ideas are often in the independent clause, the strong clause, just like you want your patients to be independent. Same thing, it's the strong clause. While medication X may cause side effects, the potential benefits should not be ignored. Now, the main idea here is in the independent clause. Here it is. Now, if you get good at observing that and paying attention where the commas are and understanding sentence structure, you'll start to identify where main ideas are within text. It's a very useful strategy. As is the next one, contrast words. However, but, yet, therefore, as a result, there's lots of them. Answers often come after contrast words or signal words. Medication X may cause mild side effects. However, the potential benefits should not be ignored. Okay, after however. Sophisticated vocabulary and idioms. Overprescription of medication X by certain doctors raises the possibility of a conflict of interest. Conflict, two different parties. If there's a conflict of interest, personal interest versus interest to my patient. It's quite formal. Sometimes if you get 4 answer choices and you don't know which one it is, but in answer choice B, there is a word, a formal word that you don't know the meaning of, perhaps the clock is ticking, sometimes you choose answer choices with containing words, sophisticated vocabulary that you don't even know the meaning of, rather than doing, oh, it's B, it's A, I think A is wrong, but at least I understand it. No. In that case, if your instincts are telling you it's wrong, you're probably right. Perhaps choose something, go out of your comfort zone, perhaps even choose an answer choice that you don't quite understand, but it sounds professional and formal, especially if you're under time pressure. And lastly, look out for synonyms. When ruling in an answer choice, you need evidence to confirm that you're correct. So make sure you find the synonyms in the text. That's your matching activity. It can be hard, but you have to do the match, because when you get a choice between A and D, one of them is right, one of them is wrong, they both seem likely. It's going to come down to little nuances of meaning, and you need evidence. The evidence shouldn't be your knowledge. The evidence should be in the text, right? Because that's what the question relates to. Now, that's just a few of the strategies, and this is the kind of thing that we do in detail in our live lectures. So just studying with OET Online, if you come to our live lectures, in our reading classes, we do this stuff in detail, and the more you do it, the better you get. So if reading is your challenge, everyone, then I'd highly recommend you sign up to one of our courses and watch your scores improve. Same for listening. Okay, we're going to do a little practice, everyone. This is a reading part B. We've got 3 answer choices. So this time we'll do this strategy where we'll just have a quick look at our questions. So we'll read the text and answer choices, but I'll show you my technique. As explained in the protocol, this is a protocol, the position of the RUM container will ideally, okay, it's about position, right? The position will ideally encourage participation in the scheme, emphasize the value of recycling, facilitate public access. See how we got 3 verbs? I find that quite useful because I can align them, right? Now we're going to read it. A returned, unwanted RUM project approved container will be delivered by the wholesaler to the participating pharmacy. That's our background. The container is to be kept in a section of the dispensary or in a room or enclosure in the pharmacy to which the public does not have access. The container may be placed in a visible position. We can see it, but out of reach of the public, as this will reinforce the message that unwanted prescription drugs can be returned to the pharmacy and that the returned medicine will not be recycled. That's an important paragraph. This is about the position. Needles, other sharps, and liquid cytotoxic products should not be placed in the container, but in one specifically designed for such waste. All right, we've read it. So encourage participation in the scheme. Sounds possible, but let me check. Emphasize the value of recycling. Hang on. It said the products will not be recycled. So we're going to rule out B. It's opposite. Facilitate public access to it. Facilitate, it means give access. But here it says we need to be placed where the public does not have access. It must be A. Encourage participation. But now I'm going to look for my synonyms. Encourage. How do we do it? Must be placed in a visible position. I guess that would encourage. This will reinforce the message. Oh, reinforce. That's a bit like encourage, isn't it? Reinforce the message that unwanted prescription can be returned. Okay, so that means they can be. That means you can participate. You can return. Definitely our answer is going to be A. And we've got our synonyms and it summarizes it. There's our answer. All right. Now you have to make sure, see what I did? I ruled out. And then encourage is to reinforce. If you reinforce the message, then you're encouraging people to participate. There it is. Okay. Now, one thing I would highly recommend you do is always build vocabulary. So when you see idioms and expressions and words you don't know, keep that list. So we've got the bearer of bad news. What does that mean? It means the person who brings the bad news. If you're the bearer, you're carrying it. You bear weight. So the bringer of bad news. And the heart of the issue. We know the heart is a vital organ, the heart of the issue. It's the center, the core, right? So that's a nice idiom. These will come up in our reading. So this is our part C, everyone. What is the writer doing in the second paragraph? So this is a doing word. That's important to me. What is the writer doing? Now we read it, particularly in part C. So let's read it together to understand. The worst fear for medical professionals, particularly less experienced ones, is that the patient will blame them personally. So it's the worst fear, will blame them personally for the bad news that they bring. Of course, the phenomenon of identifying the bad news with the bearer, there it is, the bearer of bad news, identifying the bad news with the bearer of it isn't unique to our profession, medical professions. At the heart, there it is, at the heart, the center, this is the main idea, is the issue of how easy it is to find a target to blame. So there's an issue, a target to blame. If someone, then we got a semicolon. Ooh, this is an example. If someone officially in authority conveys the bad news, conveys, to tell, right? It becomes easy to direct the anger aroused by the news at this person, at this someone, right? That's a link. Therefore, watch out for this word. Therefore, as medical professionals, we should naturally expect this kind of reaction. Which reaction, everyone? We must go back. We're looking for a reaction. It's the anger aroused. That's the reaction. We should naturally expect this kind of reaction from our patients when it falls to us to deliver the bad news. Now, let's see if we can work it out. What is the writer doing in the second paragraph? Describing a means of solving a problem. Well, they do talk about a problem being blamed for something, don't they? But they're not solving it, are they? So that's wrong. No solutions given. Explaining why something often happens. Well, I felt there was some sort of explanation. What did you think? Was there an explanation? Why? Well, they're talking about blame. Often, though, I'm not sure if it happens often, but what I would do here, and I often do this strategy, I'll put a question mark. No, not a tick. I don't want a tick. I'll put a question mark when I know it's a possibility. C, justifying a suggestion which has been made. Sounds strange to my way of thinking. Justifying a suggestion. Don't know if things are being justified. We're explaining why someone reacts, but that's not a suggestion, right? So I'm going to say unlikely. Could be wrong. Giving an example. Oh, this is an example of something already mentioned. Well, we know it's an example of something already mentioned. But this is hypothetical. If someone, it's not saying someone did something. This is a hypothetical. So it's not already mentioned. Doesn't sound right. I think it's wrong. So it must be B. Now, I need to be sure, because I could be wrong, explaining why something often happens. So at the heart is the issue of how easy it is to find a target for the blame. If someone in authority, I've got to read it again, conveys the bad news, it becomes easier. So this is explaining, because if someone conveys the bad news, it becomes easy to direct anger. So they're explaining the process behind why someone gets angry at the bearer of bad news, even though not the news itself, they're targeting the person who delivered the bad news. Therefore, as medical professionals, we should naturally expect this kind of reaction, naturally expect from our patients. Often happens. That's close enough for me. We should naturally expect it. We should expect this action. So in other words, it's common. Naturally, this happens. Don't be surprised. Naturally expect. It's the opposite of being surprised. So I would say yes, explain why something often happens. So I'm going to say the answer here is B, bingo. And we get it. We look at those expressions at its heart. Therefore, these are clues to this is the area where the answer can be found. And that's often a hard part of reading, knowing where the answer is. All right. So I've just given you 2 examples here today, everyone, for multiple choice questions. And we've also looked at part A and how to deal with it, with that strategic approach. Now, if you want more, come along and check out our free taster course at OET Online, and contact us via these details, right? Doesn't matter what your profession. We have courses for all 12 professions tested by OET exam, and we have an excellent timetable, twice daily live classes. You'll see me there every week delivering classes, and you'll be supported by the excellent teaching team that we have at OET Online. Courses are great value, so I really encourage you to visit the website oetonline.net.au, and we'll help you succeed in OET on your next attempt. Thanks for watching this video, and I wish you good progress. Bye for now.